I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of the IDD Health Matters podcast. I have a great guest today, Dr. Anthony Rodriguez. How are you, Anthony?
I'm doing great. Thank you for inviting me on.
Yeah, glad you're here. So, Anthony, I'm just going to turn it over to you and talk about what you do in this field and how you got into this field.
Sure. So I got in this field first as a paraprofessional. So I started off midway through college. I think I was a finance major, and I really didn't want to be in schools at all, but I started off in the elementary school as basically to bide time in the wintertime when I was working outside. And as the weeks went on, as the months went on, I started realizing that, not only was there value here, there's really important work. These kids started to matter. And regardless of my lack of skill, I still felt like I could contribute something. And I had a whole lot to learn. I switched my major shortly thereafter, and I started focusing more on how people with disabilities learn mathematics. Okay. And where did that lead to?
That windy road.
Like many of us.
Yeah, absolutely. Yeah. I graduated and then ended up finding a free program at the University of New Mexico. As long as I taught in the schools, I got my master's degree paid for.
Nice.
And I started meeting some of those mentors that ended up bringing me back for my PhD many years later. And they valued, that I could get this cross-hybrid PhD degree in both having mathematics faculty on there and also intellectual disability faculty on there. And they worked collaboratively. They taught me a lot of great professional skills. And I realized that both of them respected what they didn't know. So my mathematics faculty were totally respectful of the intellectual disability faculty and vice versa. They weren't trying to, big time anything.
That's important, is understanding the things that we don't know, or sometimes the things that we don't do well. And I think that opens up opportunities for growth. If we think we do everything well, we're not going to grow as much as we might otherwise. Yeah. So what about now? Where are you now in the work that you're doing in this field?
Sure. So I'm at Providence College. Just became full professor a year ago.
Great.
And I'm starting to kind of go back to the well, go back to community-based research, community-based outreach, advocacy. I'm also thinking of going back to my original work, which was running a self-advocacy center, teaching mathematics skills through finance, through scam avoidance, through money, financial, being fiscally responsible and things like that. And I'm hoping to open those doors up again and reconnect, except now in Rhode Island.
So do you spend more of your time in research or teaching, or what's kind of the mix there?
The great part about Providence College, they really value all three: the research, the practice, and the service. And they've been open to me balancing literally 33% across the board. So I've been able to publish, but they've encouraged me to be out in the community. So it's been a good balance. I was really on the fence on which one I wanted to go to, straight R1 or straight maybe a state college, local college, and this one gives me the opportunity to do both.
Great. So what areas of research related to intellectual disabilities have you really focused on or worked on?
Sure. I would say workforce issues and how to use applied algebra for daily living for people with intellectual disabilities, and to learn those very basic algebraic skills that could easily apply to making the most of whatever they're given, whatever support they're given, whatever amount of money they have, and to be basically to almost be they can't take advantage of you. So, and there's always somebody out there trying to, and we had this in the research, just heard the stories of various people taking things from them.
That's true more than ever about people trying to scam us, and just open up your email if you
absolutely
if you haven't tried to been scammed lately, you'll find a couple of opportunities to get scammed there. Do you have a favorite success story of someone that you've worked with or impacted through the work that you do?
Sure. Yeah. I'm thinking long term. I had a student in the Money Club who was working with their guardian to rebuild some trust, and it had to do with poor choices and spending at the casino. There's a lot of casinos around Albuquerque, and they like you said, they print everybody, the elderly, anybody. They have all these free things, free buffet if you show up,
Sure.
or I'll match your first bet,
Sure.
things of that nature. And actually that goes along with like DraftKings for youth right now. It's just a general pull on everyone, and he got himself into trouble. And he lost a lot of money and got himself into debt, and his guardian rightfully was concerned. And through the Money Club, he was able to show durable habits that he was committed to, and that he showed results over a period of time. And she ended up granting him the freedoms that he wanted. And it was cool to watch. It was cool to watch him struggle through it. And it was cool to watch him continue to step into it. And then at the end, when you heard from her, it was beautiful. It was really beautiful.
Yeah, she was probably excited about that too, and being able to give him back that ability and power to spend money the way he
Absolutely.
wanted to, maybe a little more responsibly this time.
Yeah.
Yeah. So, Anthony, I know you're walking into a new role here at,
Yes.
so we are coming to you from the AAIDD Conference, the American Association on Intellectual and Developmental Disabilities 2025 conference, and talk about what's up for you next in this organization.
Sure. After this conference is over, I'm stepping into the role of president of the association, and I think it will continue some of the research. So the most powerful parts of the financial independence class was the peer mentoring, the peer-to-peer mentoring, and the general connectivity between the people, and the trust that we had of telling our stories, owning our ups and downs, and then also finding fixes for it. So what I'd like for the organization, we have a tremendous, and congratulations, by the way, as your fellow status this year.
Thank you.
That's
Appreciate
a truly amazing accomplishment, and we've got great, talented people like yourself in so many different areas. How to harness that energy. So in the next year, I definitely want to focus on fellows and focus on just setting up opportunities, serendipitous events to connect everyone, and just to channel, especially now with some of the chaos that's happening, ground us in our experts, which are our fellows.
Well, I know that as an incoming president this past year, you were kind of heavily involved in this conference planning, and you chose the topic of mentoring, right?
Yep.
Yeah.
Yep.
So that's an important thing to you.
Yeah. Maggie and myself, we really wordsmithed. Maggie Nagrin's the executive director, CEO of our
Maggie's
organization.
Been on before as well too.
Yeah. No, she's amazing.
Yep.
And just the back and forth and the dialogues throughout this year has really gotten it to where we both are, I think, proud of the work, for sure.
Well, there's a lot to be proud of in this organization. And if I get the numbers right, 149 years. This is the oldest organization that works in this field, in this space. And so next year will be the 150th anniversary, right?
I think sesquicentennial.
Oh, I don't know that word.
Well, I've been practicing it because people have been telling, don't you know it's going to be the sesquicentennial? I'm like, what did you just say?
Well, that's exciting. I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. One of the things that I ask every guest is to talk about 3 tips, 3 words of wisdom, 3 pieces of advice that you'd like everyone to know that you think can have a really positive impact in the field of supports and services or health and wellness for people with intellectual and developmental disabilities. So it's your turn.
Okay, all right. I was just thinking of silos when you were speaking of that. Is silos are places of fear, and I think we have so many different people that are literally right next to us, maybe in a different specialization, but all focusing on IDD, that if we break out of those silos, we start building more community. Community kind of eradicates fear, and our amygdala can stop going, bananas, and we can actually kind of calm and get the work done. So just knowing that we have a community, and the people on your listening to your podcast, that we do have a community, a very strong community, and if you feel alone, just reach out to us, and we'll hopefully with the fellows we'll connect them, and that can be assuaged.
So building connection, getting away from the silos.
Yeah, it's dangerous. The specialization sometimes is literally our biggest support can be right next to us, and we don't even know it's there.
That's very true. That is.
And I'm thinking, with that, like calm is your best tool in all of this. Is the ups and downs, the the triggering by the news and things of that nature. Is just know that we are going to move through this, and it's not going to be easy, but we are going to get through this. It's not an option with our group.
I totally agree with that, and the fact that the group has been here for 149 plus years speaks to that pretty clearly. That this organization and the people in the organization and the work that we do will continue. And, in whatever environment there is, maintain focus on what we're here for, and we'll get through it.
Yeah.
I support that as well. Do you have a third?
I was just thinking storytelling. I think the stuff that you're doing is very powerful. That's like, I would say the highest leverage teaching tool is storytelling with facts and figures and mixed in, and just how you can optimize uptake of whatever it is through a story more than anything else. And this podcast, I think, is a powerful example of that.
So get out there and tell your stories, everybody. And
Absolutely.
Thank you for telling your story today. Thanks for spending a few minutes with me talking about this. I wish you the best in the upcoming presidency.
Thank you. I appreciate it.
Thanks for the great work that you do in the field.
Absolutely. You as well, and congratulations.
Thanks. Appreciate it. And to you too.
Take care.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.